My name is Dr. Megan Kalucy. I'm the lead in undergraduate psychiatry education at UNSW. This year I worked with the local mental health service to introduce a novel, interactive and multidisciplinary learning activity for second year medical students that introduced them to key concepts in mental health and the mental health system through the perspective of users and providers of mental health services, and in the process helped to break down stigmatising attitudes that impacted adversely on professional patient-doctor interactions. We delivered 8 two-hour teaching sessions to groups of 30 to 40 medical students with 2 facilitators. One, a mental health service provider, a psychiatrist, psychologist, occupational therapist or mental health nurse, and the other a peer worker. Peer workers are people living with mental health disorders who support patients in their recovery process. We utilised PowerPoint slides to prompt discussion of key issues, and the digital interactive tool Slido to facilitate audience participation through mini quizzes, word clouds, and most significantly, through allowing students to ask questions anonymously. We modelled the anonymous question process on the ABC program You Can't Ask That, as it allows individuals to ask challenging, controversial, and potentially embarrassing or personal questions. The activity received overwhelmingly positive feedback from participants and facilitators. Students reflected that meeting the peer workers changed their understanding of living with mental illness and the mental health system. Slido was really effective in facilitating engagement, and students particularly commented on the benefits of the anonymous question facility. Thank you.